Welcome to my information channel concerning degenerative spinal disorders. This channel is based on the highest scientific level. Pseudoscience has no place here. Unfortunately, also in science there is an increase of fake news and fraud, so figuring out the truth is very hard. Anyone who has genuine interest in objective and full information will find this here. We have been in the pole position since 25 years in the field of degenerative spinal disorders and are performing surgery since 30 years. Since 1992, we are among the best in the field of diagnosis and treatment of disc surgery, especially herniated discs, narrow spinal canal, spondylosis, spondyloarthrosis, spondylolysis, osteoporosis. Since 1994, we are highly focused in revision surgery, also known as failed back surgery, in combination with neurolysis. We also offer pain therapies. This leading position is possible due to a combination of basic science and clinical applications, as seen below. Real-time MRI, laser disc surgery, laser spine surgery, endoscopic and percutaneous spine surgery. Digitalization leads to an acceleration of processes, a speed as never before in the history of humanity. In order to achieve and maintain a leading position in global competition, we applied the newest information technologies right from the start. Digitalization is the new standard. Since 1997, we developed in a joint venture a spine-specific electronic software, electronic patient record. A universal information system allows us statistical evaluation based on the bulge algorithm. In all these areas, we are far ahead of our competition, so we can introduce an internal benchmark, and we also introduced a digital imaging storage in 1997, and also in this field we are in a leading position at that time with the University of Bern. In this way we have achieved a high quality unique selling point, not only in the Swiss market, possibly even worldwide, since so far a similar highly developed system has not been met at international congresses. As a result, efficiency has been increased and optimized not only in administrative processes but also in most of medical processes. Thus, there is more time for patients, clarifications, case history, examinations, specific diagnostic procedures, consultings, explanations, prospective data sampling, and therapeutic guidance according to algorithmic guidelines, and also information to referring colleagues, insurance companies, administrations at the end, also for public informations. This is our unique selling point. Success is primarily the result of right decisions and has much less to do with luck and destiny. Focusing and prioritizing on degenerative spinal disorders in combination with digitalization, respectively digital technology, are additional elements for success. Two main requirements determine the way to success. First, the individual factor, e.g., highest mental and physical shape, innate talent, a comprehensive knowledge in the field of all natural sciences, passion for the profession, interests and enthusiasm for everything new, creativity, objective thinking, lightning fast decision making, high mental flexibility and adaptability for rapid changes, high degree of learning ability, stability, and mental integrity. And last but not at least, teamwork. What is still good today may not be good enough for tomorrow. Those who want to survive in the evolutionary struggle must always adapt to change. But nothing is more important than personal experiences. Knowledge is the result of observation, experimentation, and measuring. Additionally, you need an outstanding ability or talent to transfer all these qualities into practice. It takes years to achieve such a high degree of personal experiences. Besides, pseudoscience, rankings, career thinking, greed are excluded in our teams. The second element concerns structural factors. Switzerland and Zurich has high location qualities, an excellent infrastructure, and world-class faculties, such as the Swiss Federal Institute of Technology in Zurich, there is another one in Lausanne, the University of Zurich, and the University Hospital of Zurich. We have a high legal certainty and a high prosperity concerning the gross domestic product, which is one of the highest in the world. High prosperity with foundation of high-ranking private clinics are the consequences. So we have the Swiss Medical Network Group with the private clinic Bethanien in Zurich, and the Hirslanden Group, the biggest group in Switzerland, with the Hirslanden Clinic and the clinic Impark. I have nothing against private-public partnership, but I prefer private companies. Due to that, high-tech availability is the result. Digital X-ray, 3D imaging, positron emissions tomography, single photon emissions computer tomography are all available. Chaos, computer-assisted operating system, since 1997 we first saw this system in use in New York at the Hospital for Special Surgery. Then also hybrid systems. The combination of robotic and computer-guided surgery is also available. Hence, we have several advantages compared to other competitors. The combination of basic research, digitalization, IT allows us to look for innovation and to test different methods, such as the percutaneous discectomy, first introduced at Balgrist by Professor Adam Schreiber in 1979, then ultraviolet laser surgery in 1989, and in 1992, holmium-YAG laser, besides neodymium-YAG laser, real-time MRI in 1994, and the introduction of the PLIF procedure by myself in 1994 in Zurich. And also the first efficient and successful iliosacral fusion technique in 2004. The unique constellation of different factors allowed us to use most modern diagnostic devices by General Electric, Philips, Siemens, or Toshiba. As already mentioned, OpenMRI, 3 Tesla MRI, PET, SPECT, and others. This experiences and technical knowledge has been transferred into the practice. Minimal invasive surgery, endoscopic spine surgery, percutaneous endoscopic spine and disc surgery, microscopical spine surgery, computer assisting operating system for spine surgery. First, we focused on minimal invasive techniques with lasers, neodymium-YAG and holmium-YAG, then continually expanded the procedures from percutaneous to endoscopic to open procedures. Open real-time MRI disc operation, the first worldwide, was performed 1995 at the University Hospital. This was a procedure in local anesthesia and guided ambulatory. Nevertheless, of all these micro-invasive techniques, standard discectomy is still the gold standard. A comparison with standard procedures was performed already in 2002. An outcome competition took place, controlled and triggered by our government. And to our surprise, we won the competition among the most famous Swiss institutions. The evaluation was performed by the Federal Swiss Institution of Lausanne. We were never simple users, we always were pioneers, especially concerning stabilization procedures. We knew since our beginning that fusion procedures will be and build the future. Simple due to the increasing average age of populations worldwide and evolutive induced physical decay. We co-developed in 1997 a highly successful new transpedicular device for spinal fixation, as the only Swiss team among 10 other international faculties. Hence, we became a national and international reference center for spinal fixation. The second successful vision concerned the interbody fusion technology. I introduced this procedure at the University Balgrist in 1995 after visiting the inventor of transforaminal approach, Professor Jürgen Harms, one of the most famous spine surgeons worldwide. We never chose an unsuccessful surgical method since 25 years, in contrast to all our neighbor clinics. We considered always several methods as mere fashions. For example, stand-alone procedures, the early stand-alone procedures. They were sentenced to fail. Then cylindric cages, maybe the BAK cage, the Ray cage, the IVIS cage, were sentenced to fail. Dynamic methods such as Dynesis, Isolock showed no better result than standard procedures. Even the disc prosthesis was first introduced in 1983 in Berlin, Germany, has no sustainability up to today. Chaos will be the future. Computer-guided and robot-guided assisted systems at present serve more as a marketing tool than as an actual improvement of surgical procedures. We are sure that within the next few years, a computational and robotic breakthrough will take place. This is the result of a meta-analysis worldwide made in August 2018. The future. The future lies in the co-work between man and machine, speech recognition, image recognition, self-driving cars, navigation will be the future. Virtual reality, augmented reality, 3D printing transform most companies over the next few years. This will be the case in most areas of medicine, including surgery. This change will take place in a kind of dynamic that has never before existed in human history. We are living in a world of increased complexity. Those who are unable to adapt to this rapid change in competition will no longer be able to survive. But there is still one major limiting factor in this rapid increase in efficiency. This factor is the human factor. As long as certain superior abilities are tied to the individual's abilities, as is undoubtedly the case in surgery, quantitative limitations are an unavoidable fact. Concrete. Even the best of his discipline will only be able to operate on a limited number of patients per year or within a certain time period. Thus, only a small number of patients per year can benefit from the special knowledge and skills of a few top surgeons. In short, demand always exceeds supply. Even the best surgeon in the world, if one is able to determine such objectively at all, is subject to this iron limitation. Demand exceeds what is available. Therefore, there is a relatively high selection pressure on every surgeon. Our philosophy, you can also call it mindset, follows Einstein's advice. Einstein's principle: make things easy as possible, but not easier. Keep simplicity in everything you do. To make things complicated is easy. To make things easy is complicated. A genius can master complicated things, others can't. Even if you are a small unit on a numerical scale, equality is the rule. It is still the single surgeon who has the main job to do, and the difference between individuals is relatively low in terms of productivity and efficiency. Therefore, even a small team is able to withstand global competition. Our methods currently offer the best price-value ratio, including the highest patient safety. The individual chapters, and our goal is enlightenment. To give best advices and preliminary informations, and you can also choose an appointment. The individual chapters give relatively understandable information about the possibilities and limitations in the field of degenerative spinal disorders and its therapies. You can enter by choosing the listed links you see in this last page.